there guys, ZMD here, and I am glad you tuned in for this week's video because we are going to be discussing energy drinks from the perspective of a doctor. More specifically, we're going to be discussing caffeine and how it affects your body. Everyone, and I mean everyone that I know pretty regularly consumes some form of caffeine these days, whether it's energy drinks or some form of caffeinated beverage. So let's talk a little bit about that today. Guys, if you haven't already, subscribe to the channel for more content so you can better yourself in the process, be more knowledgeable, and just be a boss. Okay, coffee and tea products are the most consumed and socially accepted stimulants in the world. And in fact, approximately 90% of all adults in the world consume caffeine daily. And most of the data on the health benefits and the risks of caffeine are from observational studies in which self-reported consumption of beverages is associated with particular health outcomes. And generally speaking, these types of studies make it pretty difficult to identify caffeine itself as the causative agent and to exclude various confounding variables. So based on the available data, it's difficult to sit here and conclude evidence for promoting or discouraging regular coffee and/or tea consumption for that very reason. So caffeine has multiple systemic effects on the various different organ systems in the body, and further yet, the impact on health is modified by a bunch of things like your past medical history, your genetic factors, your age, sex, and maybe other medications that you're on as well. So I think a common consensus is that for most adults, up to 400 milligrams of caffeine a day appears to be safe. Now, young adults, it's always you young adults need to be cautioned about using caffeinated energy drinks in excess and not mixing them with other substances, especially if they're on things like Adderall for ADHD or if they're doing a bunch of other drugs. Mixing a bunch of things without any oversight generally is a bad idea. Now, energy drinks and shots are other forms of caffeine-containing beverages, which typically contain 100 to 200 milligrams of caffeine per serving. And although some do contain higher amounts, as you can see in this chart over here, male adolescents and young adults are the typical consumers, and you see all these ads on YouTube with the Bang energy drinks on a bunch of big channels, and so everyone promotes that stuff. Usually it's intended for that type of audience of young, testosterone-filled, gym-going males. Yeah, brah. But there are hundreds of different brands of caffeinated energy beverages that exist, with caffeine content varying from 50 milligrams to 500 milligrams per can or bottle. So you may want to examine that the next time you have your drink. Though not particularly common, I was able to find isolated case studies that discuss serious adverse effects in adults, including atrial fibrillation, which is an abnormal heart rhythm, and even seizures from caffeinated energy drinks when the total dose of caffeine consumed was at levels of 480 milligrams and higher. Now, let's rewind for just a sec and talk about caffeine's metabolism. Caffeine is rapidly absorbed in the gastrointestinal tract. So caffeine is a potent antagonist of the central and peripheral nervous system adenosine receptor, and thereby it stimulates the release of excitatory neurotransmitter. That's what gives you all those stimulant effects. Now, there aren't too many medicines, especially more of the common ones that we generally use, that have super strong interactions with caffeine. There are weaker interactions between caffeine and some of the commonly prescribed psych drugs sometimes, like Wellbutrin, lithium, clozapine. But even then, moderate caffeine consumption, which is about 1 to 2 cups of coffee a day, is very unlikely to lead to any serious drug interactions, so you're probably good. Some people who are very, very heavy caffeine consumers, they might want to know that. Now, caffeine's general physiologic effects are dose dependent. So what that means is the more you take, the more of the effects you're gonna notice. In addition, epidemiologic studies of caffeine may be confounded by several variables. In general, healthy individuals are more likely to use caffeine than unhealthy persons. So it's tough to make definitive conclusions, as I previously mentioned. Caffeine, as far as its cognitive and neuropsychiatric effects, has been shown to influence cognition and mood, both when used acutely and chronically. In rested individuals, caffeine in low and moderate doses, which is approximately anywhere from 50 to 300 milligrams, improves vigilance and reaction time. In sleep-deprived individuals specifically, caffeine's positive effects generalize to a wide variety of functions, including learning, decision-making, and real-world activities such as improvement in automobile and aircraft operation. Now, individuals who are habitual consumers of coffee and tea tend to perform better on the various tests of cognitive performance, such as reaction time, visuospatial reasoning, and so not surprisingly, this stuff works. Let's talk about alertness. Caffeine consumption leads to an increased alertness, mental energy, and the ability to concentrate, particularly when subjects are fatigued or working at night. And this is probably the real fundamental reason why so many people regularly consume caffeine. I mean, and interestingly enough, in the hospital, I've always noticed that, especially at night service, a lot of the residents tend to intake a lot, and I mean a lot, of caffeine. A systemic review of 13 randomized trials of people with jet lag and shift work disorder found that caffeine significantly improved concept formation, reasoning, memory, orientation, attention, and perception when compared with placebo. Now, I do want to talk about headache, as it's one of the more common effects of caffeine. Now, caffeine has significant pharmacologic properties that can help or even cause headache symptoms. Isn't that just typical of medicine? I'm telling you, the treatment of a condition is also what causes it. Go figure. Some randomized trials have found that combination meds that include caffeine are more effective for tension and migraine headaches than your basic Tylenol or your low-dose ibuprofen alone. Conversely, on the other hand, being a regular and having habitual caffeine consumption is associated with chronic migraines and analgesic rebound headaches. Additionally, headaches are also the most common symptom of caffeine withdrawal. Now, if you are someone with chronic migraines, it's just something to keep in mind. Okay, now psychiatric conditions. Now, caffeine intake is associated with a wide range of psychiatric symptoms and disorders, but there's no evidence of causality, which is the big key to keep in mind. I'm telling you, it's associated with it, not necessarily causing it, which I know seems frustrating, but hey, that's the data we got. What do you want me to do? Acute caffeine intake is associated with anxiety, nervousness, insomnia, irritability, and even panic attacks in healthy volunteers. My advice would be that if you have significant anxiety or psych issues, you probably should avoid too much caffeine. People with pre-existing anxiety disorders may be more susceptible to the anxiogenic effects of caffeine because it is, after all, a stimulant. In one US study of over 3,600 adult twins, caffeine intake was associated with an increased prevalence of generalized anxiety disorder, depression, panic disorder, antisocial behavior, and substance abuse, particularly those people who have a very heavy caffeine intake, which is greater than 5 cups of coffee a day. Let's just briefly touch base on heart health and coffee. So some studies suggest that low to moderate coffee consumption, which is up to 3 cups a day, may protect against a myocardial infarction, or in other words, heart attacks. However, heavy coffee intake may actually be responsible for triggering coronary and arrhythmic events, although coffee intake is not considered a long-term risk factor for heart disease in general. Now, as far as my interpretation from the literature is concerned, I don't think there is enough data to really definitively say what caffeine does for heart health, because we don't have an exact type of clear-cut evidence, just some case studies here and there. And again, everyone's different, so it can affect different people in different ways depending on a variety of things. Now, caffeine is also a potent stimulator of smooth muscles, and thus it helps with constipation. And I'm sure many of you know this from experience. Don't be shy, I see you now. Coffee consumption has been associated with decreased risk for cirrhosis, lower rate of disease progression in patients who have advanced hepatitis C, and it also lowers risk of type 2 diabetes as well. Now, there is some data suggesting that high coffee intake may be associated with lower bone mineral density and increased fracture risk in women, particularly those that have low vitamin D and calcium intake. After all that, let's just talk about mortality. Now, many but not all observational studies show an inverse relationship between coffee consumption and all-cause mortality. And that basically means that the more coffee you drink, the lower the mortality. And again, a possible explanation for these observations is that healthy people are just plain and simple more likely to select and have access to caffeine-containing beverages than those who are ill, as I previously mentioned. And to be honest, I personally wouldn't feel too strongly about promoting coffee intake to living longer. Let's have a word on caffeine dependence, abuse, and withdrawal now. Many individuals use caffeine regularly to maintain their active, busy lifestyle, since caffeine enhances mental performance and mood. Now, Let's just talk about the adverse effects of excessive caffeine. Non-serious effects included things like palpitations, tremors, agitation, upset stomachs, and less commonly, there were some individuals who demonstrated serious neurologic or cardiac signs like arrhythmias, heart disease, seizures, ischemia, hallucination. A word on dependence and abuse. Caffeine use disorder is identified as a research diagnosis in the DSM-5, which is meant to encourage studies but not to be used in the clinical setting at this time. Abuse implies that the pattern of use interferes with your normal life patterns. Difficulty stopping caffeine intake and ongoing caffeine use despite harm have not been too well documented. But that being said, heavy caffeine use is associated with an increased risk for other addictive behaviors. The proportion of current smokers and alcohol intake is significantly higher, and in a survey of high school students in Italy, caffeine use was also associated with alcohol use, gambling, internet addiction, and illicit substance abuse. Now, let's have a word on caffeine withdrawal. Randomized trials do support the existence of a caffeine withdrawal type of syndrome. A comprehensive review of caffeine withdrawal validated a bunch of symptom categories that included things like headaches, tiredness or fatigue, decreased energy, decreased alertness, excessive daytime drowsiness or sleepiness, decreased well-being, depressed mood, difficulty concentrating, irritability, being very foggy and not clear-headed. These are all a compilation of withdrawal symptoms. Sometimes even flu-like symptoms, nausea, muscle pain may be experienced. But typically headache is going to be the most common symptom of your caffeine withdrawal. And it can occur with abstinence from daily doses as low as just 100 milligrams per day. But again, the incidence and severity of symptoms increases with higher daily dose. Withdrawal symptoms typically occur within 12 to 24 hours after discontinuing caffeine, kind of peaks 1 to 2 days, and it may persist for up to 10 days. Now, re-administration of caffeine has been shown to reverse this withdrawal in as little as 30 minutes. When caffeine abstinence in a chronic caffeine user is necessary, for example, let's say you got a surgery scheduled, my suggestion is that you gradually reduce caffeine intake over the week preceding, whatever procedure you have planned. With that being said, in experimental studies, only 50% of individuals that are acutely abstaining from caffeine actually go on to experience this full-blown withdrawal. Now, in the next video, I will discuss caffeine use specifically as it pertains to athletic performance enhancement, which I assume you will find to be somewhat more useful and interesting. So guys, tune in for the next video. So don't forget to like, comment, subscribe. Again, I'll catch you guys in the next video. Keep being a boss.